Can I talk about how helpful oral low-dose naltrexone is in treating psoriasis? Once again, I have used recommended use of LDN in treating psoriasis. I showed you those two cases, the hand and the elbow pictures of psoriasis. It's very beneficial. I have, interestingly, okay, so all these autoimmune derm conditions. My friend and colleague Pam Smith said she was going to watch the presentation. I'm assuming she's out there somewhere. I've heard her lecture multiple times on autoimmune diseases. And one of the things she always is a proponent of is having the patient stop eating gluten, do a GI repair protocol, right, to restore health to the gastrointestinal tract, and then have the patient start taking low-dose naltrexone. This is for any autoimmune disease in general, right? Until proven otherwise, they probably have a gluten sensitivity. They may not have celiac disease, but they have a gluten sensitivity. And I've had other colleagues that not only do they say reduce gluten, they say get rid of grains in general, because what happens with grains, you're grinding it into a flour, and that makes the food high glycemic, right? If you're eating flour-produced products, for not all, but most of them, or a lot of them, and the high glycemic index foods are going to create more inflammation too. So in order to help the gut stop having the leak and having the inflammatory process, then that makes a lot of sense. So where I was going with this is I've seen a lot of patients who walk in who have psoriasis and they have bad diets, and a lot of them are overweight. I'm not saying everybody with psoriasis is overweight. Certainly that's not the case. But a lot of the patients I saw with psoriasis along the way have seen are obese or overweight. So weight loss, decrease in pro-inflammatory foods, fixing the gut. Oral low-dose naltrexone, I think, is absolutely one of the other adjunct therapies to put into the mix. For sure. Would any form of LDN stop psoriasis? I think LDN orally would be the more efficacious to treat psoriasis, because psoriasis is a very broad treatment or autoimmune presentation. So the immunomodulatory effects from the oral LDN would be beneficial to treat the disease. More so than the topical. Like I said, the topical is usually just a short-term pruritic treatment. It is not really going to address the underlying immune problem that's associated with psoriasis. Of course, when you're treating psoriasis, the dietary changes, lifestyle changes, the GI repair protocols that were probably necessary would be also on the menu to help the psoriasis return or to be controlled. The patient, I don't know that they can expect to be rid of their psoriasis, right? I don't see a whole lot of entire resolution of psoriasis. Maybe other people have, but I've not seen it. But it's more of a disease management process, which is extremely beneficial.